Good afternoon. My name is Bonnie Henry. I'm the Provincial Health Officer for British Columbia, and it is my honour to be here on the traditional and unceded territories of the Lekwungen-speaking peoples, the Esquimalt and Songhees First Nations. And today is our update for COVID-19 here in British Columbia for May 9th. And today we have 15 new cases who have tested positive for COVID-19 in the province, bringing our total of test positive cases to 2,330. That includes 871 people in Vancouver Coastal Health Region, 1,098 people who live in the Fraser Health Region, 125 people on Vancouver Island Health Area, 180 in the Interior Health Region, and 56 people in Northern Health. We continue to have, unfortunately, active outbreaks in our long-term care and acute care and assisted living areas, including 21 continuing active outbreaks, 16 in long-term care or assisted living, and 5 in a number of acute care units, as you're aware. We now are up to 467 cases associated with those outbreaks, 285 residents, so that's an increase in 3, and 182 staff who have been affected. 19 outbreaks have now been declared over, including one more that's been declared over, the Cedarbrook Chateau outbreak in the Fraser Health Region, so that is good news. We have no new community outbreaks, and we continue to provide support in the number of outbreaks that we have ongoing in the community around BC. Currently, there are 69 people hospitalized with COVID-19 in British Columbia, and of those, 21 people are now in critical care or ICU. Unfortunately, we've had an additional 2 people who have died from COVID-19 in British Columbia, both of them residents of long-term care in the Vancouver coastal area, bringing our total of people who have died from COVID-19 to 129 in British Columbia. And our hearts go out to the families, particularly the families, the communities, and the care providers for these residents, these people. We have had an increase in a number of people who have recovered now from COVID-19, bringing our total of 1,659 people who have completely recovered. That's 71% of our confirmed cases, and that's the positive side of this, is that people are continuing to recover from this disease. I want to talk a little bit about, as we all know, tomorrow is Mother's Day. It's a day that we celebrate our mothers, our grandmothers, our sisters, our aunties, and we recognize the important role that they play in our lives. Let's show how much we care for them by ensuring we are doing all we can do to keep them safe. Safe physical distance remains an important part of what we need to do right now in British Columbia to keep all of our mothers and our communities safe. And particularly if your mother is older, if she's awaiting surgery, has any underlying illnesses, avoid that close physical contact, even if we know how much we all want and need that. Honor our mothers by keeping them safe. If she's not part of your household right now, your pandemic bubble or your small group, your household group, this is a great weekend to spend time with her outdoors, keeping your safe distance. And we're very lucky that we have the weather to be able to do that in many places in BC this weekend. So have a happy Mother's Day and respect and honor all our mothers and our elders by keeping them safe. I would also like to speak to our seniors and elders for a moment. I know this has been the most difficult and trying time for all of you, and I understand how lonely it can be with your family and friends unable to visit right now, and how many of our seniors and elders needed to stay in their own cocoon to protect themselves. And as you know, the nature of COVID-19 has shown that this virus can have a tremendously negative impact on our seniors and elders, and we have lost many of those keepers of our culture and our history and our common family bonds. As a result, the best thing you can do right now to protect yourself and to ensure that you're there for your family is to minimize your contact with others right now, especially if you're somebody who has underlying illness, who has an immune compromised condition. We know that this virus can be tragic for you. If you do live independently, continue to take precautions, but see your family at a safe distance. And with this nice weather, that can mean a safe distance outdoors, where we can see each other and have that important contact, even if it's not physical contact. We continue to see new outbreaks, unfortunately, in our long-term care homes and in our assisted living facilities. And even though we are putting these measures in place to try and best we can protect those valuable seniors and elders in that setting, this means for now we must continue to have restriction on visitors. We recognize absolutely how essential family members are for providing care in our long-term care and assisted living facilities. But we are working absolutely on plans to make sure that we can let families back in to support our seniors and elders, but in a safe way, so that it is safe for the whole community within that facility. And that will be coming. These new ways of doing things will be coming in the coming weeks and days. As we are learning more about this virus and how we can best protect each other from it, we will find ways to allow for that important social contact while making sure we're not putting anybody else in that facility at risk. And when we do that, the families that are who are suffering most from this forced separation, we will be telling you how we can do that and how we can best do it in your facility with your family member. Right now, as I have said a number of times, we're still at the end of the first phase of this pandemic. We are not yet ready to move into phase 2. We are still in phase 1, which means we must all continue to do what we have been doing that has been so successful here. So this weekend, as you enjoy time with your family, please remember that the risks are still here in our communities. The risks of this virus are still very high. Keep doing what you have been doing to protect our families, our communities, and to keep BC strong. This is very much a necessity for all of us, and we are looking forward to the coming times, hopefully by next weekend, where we can, if things continue on this trajectory, where we can start expanding our connections with people who are close to us. So for this, remember, fewer faces and bigger spaces remains important, key to our shared success. And the path forward for all of us is in our hands, and remembering to wash them, and also to continue what we have been doing, and that is being kind and being calm and being safe. Thank you, and I'm happy to take questions.
Thank you. As a reminder to everybody on the phone, please press *1 to enter the queue. You are limited to 1 question. I would also ask that you please unmute your phones. You will not be audible until I call your name. First question is from John Hernandez, CBC.
Hey there. Can you just confirm how you would like to see people gather to mark Mother's Day this weekend and how that can or will be different for the long weekend?
Well, right now we are still telling people that you can go outside and you can gather, but with your household, your family, the people that you've been keeping close for the last few weeks. Those are the people that you can have that close contact with. If we are outside, and I have been encouraging people to go outside because I know how important it is to our mental health and our physical health as well, but keep that safe distance. That is incredibly important. And even when we move into phase 2, we still need to remind ourselves that we may expand our circle a little bit, but not to the point where we are congregating and when we have lots of groups of people together and not making that safe distance between us. Because we know that that is one of the most important things we can do to prevent the transmission of this illness. We know that this virus is still in our communities. So it is important for us to make sure that we continue these measures that have been successful in protecting our families and our communities. So that's safe distance. It's absolutely staying away from others if you're feeling unwell, even the least bit unwell. We know we have to be incredibly sensitive about that right now, and that will continue into the next phase come next weekend as well. The importance of washing our hands regularly and not touching our face, those are all things that will continue in the next weekend. But we can look forward to, if we continue to see the progression that we're seeing in the reduction of numbers of cases in our community, then we can look forward to expanding our circles, not to where we were in December, but our pre-COVID, our post-COVID new normal, expanding our circles a little bit.
Next question is from Vaughn Palmer, Vancouver Sun.
Good day, Dr. Henry. You mentioned a little while ago that the Center for Disease Control was vetting serology tests, antibody tests, and you thought that several of them looked promising. Could you give an update, please, on where that stands and when we might start doing antibody testing in BC? And the other thing I was wondering, wasn't entirely clear in the presentation on reopening or bringing back the canceled surgeries. Have you got an estimate of how much capacity will have to be kept in reserve in the hospital system against the possibility of a second wave during the flu season come October?
Okay, good questions. In terms of serology, yes, the testing, the validation is ongoing. I have to say, for all of us across the country, it's a bit of a frustrating process because the tests are not as good as we would hope them to be. So what we look for is how well they detect people who have the virus and how well they determine people who don't have the virus. So that's what we call sensitivity and specificity. And we are continuing. There are a couple of good candidates that BC CDC is working on, two in particular, that they are in the midst of testing people who we know had this illness and looking at the antibody levels and how well the test performs. So validating the test. It's taken longer than we expected, but we do have two, as I mentioned, candidates which we think will be helpful for us. I will put this in the context, though, and I've talked about this a number of times. We've had protocols, research protocols set up quite some time ago, as soon as this started, in case we needed them, and as it turns out we do, to look at how many people might have antibodies in the community before this started, and then we're looking at the second phase of this in the coming weeks, and this serology test will be used in that respect, and then we'll be doing it again in 6 months. The other thing that's going on nationally is there's a whole expert panel on immunogenicity and looking at the immune effects of this virus. And so there's a lot of unknowns. I'm very proud and pleased that there are a number of scientists from BC who are on this national panel, including Dr. Mel Krajden, Dr. Deb Money, who's one of our amazing obstetrician gynecologist researchers here, and Dr. Gina Ogilvie, who's also a credible researcher in public health physician in BC. So there's a number of others as well, but they're all on this panel looking at how we can look at the immunity and how long it lasts in people, whether there's a difference, whether somebody's had a more severe illness or a milder illness, how many antibody levels, what are the antibody levels that are protective. So all of these are really important questions for us and will help us understand what things we need to do for people who have been infected before. One of the things that we are hopeful is that once you have been sick with this, and hopefully even a mild illness, that you will have some immunity for a period of time, for example, for years, which would be really helpful because that would be make it a lot easier for us to control this pandemic over time. We don't yet know that, however, and so the serology testing is really important. So there is much work continuing to go on that. In terms of capacity for the fall, we are looking, we're titrating it on on a week-by-week basis through the next phase. So as we start surgeries, we know that that means we'll have less capacity to expand ICU care, and right now that's fine. We'll also be looking at whether we need to have the capacity in all of the 19 hospitals that were originally designated. So it will be a little bit of titrating the capacity to what's happening on the ground. We know that influenza tends to increase in October, November, December in particular, and for us the peak tends to be later in December, January. So we'll be watching very carefully with our surveillance system over the fall to see, and the expectation is that we will have not the whole 19 hospitals with the surge capacity, but be able to locate specific hospitals to start with and then expand as needed, which means we have to have the ability to expand. And so all of the work that we've been doing to make sure that we have the protocols in place and the separate areas, separate wards where people with COVID can be assessed and cared for and not cross-populate in other parts of the hospital. All of that will be worked out over the coming weeks. I'm hopeful that during the summer, if we keep doing what we're doing and have these very low levels in our community, that we'll be able to ramp up in many, many hospitals for the surgery to be able to keep things going. And then it'll really depend on our surveillance in the fall. So how well we're able to monitor for both COVID and for influenza, and then go from there.
Next question is from Dirk Meisner, Canadian Press.
Hello, Dr. Henry. I know everyone's talking about loosening the restrictions and moving forward, but I'm just wondering what would trigger you to decide that things are falling, if this happens, that things are falling backwards and we need to put restrictions back on?
Yeah, this is the question, and what we've tried to propose. So our phase 2, this is why I've been so careful about saying, this is not going back to where we were. We know from the modeling that if we go back to having large groups of people together in certain circumstances, particularly congregating indoors where we know the risk is greater because we spend more time close to each other with less ventilation, and as we've learned from this virus, people can spread it when they have very mild illness or before they show symptoms or realize they have symptoms. So those are the things that we need to focus on. We need to find that sweet spot, as I call it, I guess, for lack of a better term, where we have more connections, but not too many that we allow this virus to take off again. So that's what we'll be focusing on. And the things that we'll be watching very carefully are the number of new cases in the community that aren't linked to known transmission. So right now we have a number of outbreaks, as you're aware, and the new cases that come up, we watch them very carefully and we see, are they connected to somebody who worked at one of the poultry plants, for example, and we know that we're starting to see some of those cases arise. So somebody who was a family member or a close contact of somebody who worked in an area where there's an outbreak. So as long as we can trace those, so those are the things that we're watching very carefully and will continue to watch. If we start to see unlinked cases increase in communities geographically spread out around the province, then those are warning signs that there's more transmission than we've been detecting. We want to make sure we have a broad testing strategy, and I've said right now anybody who has any symptoms of COVID-19 can be assessed and tested across the province. We've expanded our capacity to do rapid testing in the north, in the interior, and more remote areas. Those are really important. Our ability to follow up people in a very short period of time is also what I'll be watching. So how do we have the public health capacity to be able to manage every case within a short period of time, find their contacts? So those are some of the things that we'll be watching very carefully in the coming weeks, and then of course as we go into the fall.
The next question comes from Eric Zimmer, Daily Hive.
Hi, Dr. Henry. So you talk about the risks of large groups of people congregating indoors. Last night we saw large groups of people congregating at places like Kitsilano Beach, Sunset Beach. We got reports of people having beach fires in Victoria. And just kind of want to get your response to that. Earlier this week, you said you believe people will do the right thing when it comes to socially distancing, and just, wanted to get your comments on, these large groups of people that we're seeing outside and the risks that involves.
Yeah, and I've been watching as well when I go out on my walks and runs, but I think most people are doing the right thing. They may be in a group, but they're sitting apart from each other, and that's the key. Maintaining those physical distancing, those safe distance between us. Obviously, we have said many times, and we're not quite there yet, so please hold off. But if you are going to get together with people, it's small groups of people. We do not want to see large groups of people congregating together within small physical distances between those 2 meters. That's when we can spread it. Even if we're standing outside, the risk is lower, but we know that it's not zero if you're having close contact with somebody over a period of time, even outside. And we know that we're going to bring it back to our families and our close contacts and the people that mean the most to us. So that is why it is so important that we absolutely go outside, but don't congregate. Maintain those distances. And I think what we see is a visible minority of people, but because they're outside, we do see them. And, we need to remind people that we're not yet safe from this virus and that we're going to have to do things that are different to protect all of us and to protect the people we care for the most, because those are the people that are going to be most affected by our being in contact with others.
Ahmad Agahi, CTV.
Thank you so much. Yeah, just a quick question about the National Hockey League and looking at these neutral sites to play their games, and with that plan still in the works on their end. I was just wondering if you could maybe speak about an update of what you're hearing, if you're hearing at all from them, and what your mindset is on a National Hockey League resuming in Vancouver as a neutral site.
I have not heard anything new lately. I know they're looking at a number of cities. I think it would be something that we could do. I think it would be a really positive thing for all of us to have some hockey to watch, but it needs to be done in the right way. There would not be an audience, for example. And if the NHL has a plan that allows for the players to be protected and for us to do it in a way that minimizes contact between groups of people, then I'm absolutely open to it. I think we need to find ways, safe ways, to increase our ability to have culture and music and art in our lives through this. You need that in a pandemic. We need to have things that keep us reminded of the great things that we have in our life and in our world. And for many people, sports is one of them. So I would love to see a way that we could do this, but my primary concern is making sure that we keep people safe, and that includes the players and the teams in the NHL. So if it can be done, I think it would be a great thing for us here in BC.
Next question is from Kathy Smith, Fort Nelson News.
Oh, hi, Dr. Henry. In the Northern Rockies Regional Municipality, most recreational activities occur in what are actually enormous remote parks. Many are protected areas with numerous restrictions. And we're not sure how the eventual loosening of travel restrictions will coincide with any park openings, even for some fairly solitary activities like fishing or getting into a kayak. But people feel that responsible access to isolated parks would have a positive socioeconomic impact to the region. Can you update us on how the province can look at remote parks differently than those in urban areas?
We are looking at all that, and I absolutely agree with you. And particularly for our First Nations, our Indigenous, the Indigenous people here in BC, this going out on the land is very important. It's a culturally important thing to do right now as well. So yes, I do believe there are ways that we can look at all of the parks and, the ones that putting in place the measures that we need to keep people safe. So that does mean separation. That does mean maybe not having everybody going through the same boat slip or having access to the services in the same place. So yes, I know the province is looking at this in some detail, and we know next week that provincial parks, if all goes as planned, will be available for people for during the day, which I think is great. and then we'll be looking at how to expand that across the province. And I agree with you. I think there needs to be different approaches depending on where the parks are, and done in a measured way. And I've said, just looking around the world, from what I see, I think it's going to be some time before we see international travel, and that's not just us here in BC. That's because many countries around the world, every country around the world, has been affected by this virus. So we know that international travel is not going to be as available as for people, and we're going to have concerns about people coming into BC from international destinations as this virus is affecting other countries. So this summer is going to be the most unusual summer we have had in my lifetime, and for many of us here, one that we have never seen before. So we need to take advantage of what's close to home, with our family, with our community, and how the parks that we have here in BC are part of that.
Next question is from Lisa Cordasco, CHLY.
Thank you, Dr. Henry. We're just speaking about possible visits to extended care homes and other seniors' homes, but no such mention was made of that in BC's restart plan. And I just wondered why there was no reference to that, and what you are exploring in terms of finding ways to make this happen.
The restart plan was the beginning of the discussions, and we have been talking about this all along. We know how challenging and how hard it is, especially for our elders and seniors who are in care homes. But we've also, and I've talked about this many times, the importance of trying to protect those communities. And even though it's our one person, our family member who's in there, what we do can affect everybody else in that group. So we have to take extra precautions for people in our long-term care homes, unfortunately. And that is not going to change in the near future. So part of our plan, of course, is how can we make those key visits accessible but safe, and safe for the people who are working in the care homes, as well as for the people who are the residents and our seniors and elders in care homes. So we have, of course, been looking at it, and it will probably be different depending on the size and the type of people who are in the care home, and on the individual. So there are many different things that need to be looked at, and I will say that the health authorities have been working with the sector to try and find ways that we can that will work for everybody, but we're not at the point yet where it's safe to do that, unfortunately. So for this weekend, particularly for Mother's Day, we need to find those remote ways to support our family members who are in care homes right now.
Jane Side, North Shore News.
Hi, Dr. Henry. I am seeking some clarification regarding the restarting of elective surgery, which you spoke about a couple of days ago. When you spoke about it, you said that the situation for Lionsgate Hospital in North Vancouver was going to be dealt with a bit differently because there's an active COVID outbreak at that hospital, and that surgeries were going to be delayed there or done at other hospitals during the outbreak. I've been hearing from Vancouver Coastal Health since then that perhaps they are going to resume elective surgeries at Lionsgate Hospital. So I'm hoping that you can clarify what the situation is. Will the elective surgeries go on while the outbreak is happening, or will it be day surgeries versus ones where they have to stay overnight? Just hoping to get a bit more information, because I know there's people in North Vancouver who are eager to learn about this.
Yeah, so I don't think I said categorically one way or the other. What I said is that they would look at how surgeries could be safely done there, and it may be for some surgeries people might go to other facilities depending on how they're able to manage it. But I agree, and Vancouver Coastal has been making plans to look at how they can safely restart at least some of the surgeries at Lionsgate. But Lionsgate and Richmond Hospital hospitals, the two hospitals where we have ongoing outbreaks, they may be slightly different from the rest in terms of they may not be able to do every single type of surgery at those facilities and manage the outbreaks at the same time, but they are absolutely looking at plans on how to do it safely and how to make sure that they can ramp up surgeries in both of those facilities and ensure that we're controlling the outbreaks at the same time. So there will be a nuance to it that I don't know all of the details, but you are correct. They are looking at how we can best start up surgeries in all of the facilities across the province.
Next question is from Brishti Basu, Victoria Buzz.
Hi, Dr. Henry. Thanks for taking my question. You touched upon this a little bit earlier, but I was wondering if you'd clarify the 20 to 30 cases per day that have come up over the past week. I was wondering if those were linked to the known outbreak, since the outbreak numbers didn't increase all that much. But is it known what those cases are linked to?
Most of them have been. There have been some that we have not yet linked, and that's why I have concerns that there's still transmission in the community. And so, that's why we have to make sure that we have the contact tracing ability. And, we talk about those are the important things that we look at. So some of them may be linked in that they're a close contact of somebody who was part of it. It's finding those chains of transmission. So even though the direct outbreak cases may not have increased, the epidemiologically linked cases or the people we have tested who might be a close contact or a household member, they be included in the overall numbers. So yes, this is something that we watch very carefully. There have been a number every day this week that have arisen in the community where we have not initially found their links. So that's why we still are in that phase where we need to be so careful in our community, because we have community linked cases that we don't yet know where they got it, and we'll continue to be following those. The number is decreasing, and that's one of the key things that we'll be watching.
We have time for one more question this afternoon. For any reporters that didn't get to ask a question, there will be a statement released later this afternoon. For recommendations on protecting families and communities from COVID-19, visit bccdc.ca. For non-medical questions about the province's COVID-19 response, visit gov.bc.ca/COVID-19. And for a full listing of the Provincial Health Officer's orders, visit gov.bc.ca/PHO guidance. Last question is from Tiffany Crawford, Vancouver Sun.
Oh, hi, Dr. Henry. Yesterday, there was a big announcement that the Army and Navy was closing down. It's a 100-year-old iconic store in Vancouver, obviously not the only place to be closing because of this pandemic. I just wondered if you had a message for these businesses that are having to close permanently.
I know that's such a hard thing, and there are many, and that's one of the reasons why we are so cautiously trying to get things going again. We know how hard it is for small businesses, for restaurants. I've actually been an owner of a restaurant myself a few years ago, and I know how challenging the business can be. So for all of those businesses, this is our best defense against the economic impact is to control the virus. And that's why it is so important for us to keep doing what we're doing to get this virus under control and to keep those measures on over the coming weeks so that we're not going back to the type of gatherings that we were before. We're not allowing this virus to take off again so that we don't need to. And as I was talking about a little bit earlier, we're trying to put on measures that will allow us to open, will allow businesses to start up again in a safe way so that we do not need to put on these types of really strict and onerous restrictions again. And that's the whole purpose of what we're trying to do, and it takes all of us to do that. And I'm very saddened when I hear about businesses that are not able to weather this storm, and it's such a challenge, and it will continue to be a challenge. And it's, as I say, it's not just us, it's around the world. We're seeing these horrendous challenges, and I do also know that many businesses are looking at, or have been innovating in ways that they hadn't been before, and pushing ahead things. So there's a mixture of online and in-store experiences for people, and or virtual gym sessions, for example. So there's many things that we're seeing that are coming out of this that will be good for us in the coming months and days. But this is a very trying time. We saw the unemployment numbers come out yesterday, and we know that that has effects on people's health in the long term too. So these are things that I'm very sensitive to, and it's going to be a challenging year. But the focus that we need to have is controlling this virus, and that's what allows us to get everything else up and going again. And I will just finish by noting that yesterday was the anniversary of the eradication of smallpox. And in my world, and that's a huge thing. And for me, it just reminds us that, this was a disease that caused so much devastation around the world on an ongoing basis, but we can overcome these challenges, and we can get our society back. So we can't stop yet. We are in this together, even if we're physically apart here in BC.
That's all the time we have for today. Thank you.